Good morning. I hope many of you on the eastern seaboard are enjoying a warm day home. But for those of you like me who braved going outside, I hope you made it to the office safely. While rounding in the hospital this morning, someone who I work with quickly pulled me aside and showed me an MRI. And on that MRI was a cartilage tear or a meniscus tear in the knee. And then the question was asked, does my brother, who lives in India, need surgery? They mentioned that their brother was being told by a number of surgeons that surgery was necessary and that it should be done sooner rather than later, yada, yada, yada. I asked a simple question. Does your brother have any pain? Answer, no. He plays badminton 5 to 7 days a week, and the pain does not have any effect whatsoever on his quality of life. Now, does that patient need surgery? No. Why did that patient have an MRI in the first place? He went to his physician complaining of knee pain after a vigorous day in the gym on the day prior. An MRI was ordered and the tear identified, and now surgery all being recommended for pain that ended up disappearing on its own after 2 days of relative rest. So this brings up a very big topic, a topic that I'm very interested in, and a topic that is all the rage in social media. It focuses on our propensity towards overtreatment, certainly towards overutilization, and the risks involved with that. While ordering an MRI can be benign, what if something is identified? And what if the specialist who sees that MRI doesn't necessarily delve into the effect that the abnormality is having on the patient or their quality of life? Does that patient need surgery because something was identified on the MRI? Certainly if it's a tumor, etc., you need to do something. Certainly if it's an aortic aneurysm or you have something bleeding into your head, okay. But I'm an orthopedist, and what I'm talking about predominantly are orthopedic issues. And what I'm talking about even more so are mostly issues associated with the fact that we get older and our parts wear out. Most rotator cuff tears are attritional. Our tissues have worn out. Most meniscal tears are degenerative. The tissue has worn out. Most attritional rotator cuff tears and degenerative medial meniscal tears or meniscus tears in general do not bother people. Or if they do, they certainly do not bother them enough to warrant surgery, which can have its own consequences. And if surgery is indicated and a preoperative workup is done, some blood study might show an abnormality, which might trigger other tests. You see where I'm going with this. Not every person who walks into an office needs an MRI. Why are MRIs ordered then? Well, it's a lot faster to sit there, push on someone's joint, they say ouch, and to order an MRI, than to say let's wait for 2 weeks and see if your symptoms are going to go away on their own. And you know what? They usually do. It's a lot easier to order the MRI than it is to sit there and explain why an MRI is not necessary. And certainly there are reasons to obtain MRIs: persistent pain, certain weakness patterns, instability of the knee is buckling and giving way, and thus it leaves you at risk for falling. Now certainly I'm not offering medical advice. I'm simply saying, just because you have a few days of knee or shoulder pain, don't look for that MRI. And if one is ordered, and now your copay is $200, $300, $400, whatever it is, consider not having it done. Consider waiting and seeing if the pain subsides spontaneously. Certainly if there's something else, such as a tumor that your surgeon is thinking about, I would go ahead with the study, of course. But for simple aches and pains that are triggered by life's events and our activities of daily living, there's nothing wrong with waiting. And then find a physician who's going to treat you. There is a different personality to every injury. Not all injuries behave the same way in everyone. You can have someone with a ligament tear without instability. You can have someone with rotator cuff tears without pain and without weakness and without any night discomfort. Not all meniscal tears require surgery. Not all rotator cuff tears require surgery. I think by now you get the gist of where I'm going, so I'm going to stop. I hope you have a wonderful day. I'm going to go home and get my kids outside and probably lose a big snowball fight to all three of them.